Tularemia is a severe, often lethal disease caused by the bacterium Francisella tularensis. The bacterium typically affects small mammals such as rabbits. Due to its ability to spread through the air and quickly infect and kill humans, it is also considered a potential agent of bioterrorism. Inhaling about a dozen of the microbes, which would be smaller than a grain of salt, can result in a life-threatening infection. Once Francisella establishes itself deep in the lungs, it infects and manipulates powerful immune cells called macrophages. The bacteria disable the macrophages and replicate freely inside the cell. The bacteria also alter the ability of the cells to signal other immune cells for help. Eventually, the bacteria move out of the lung and spread to other organs, continuing to replicate until the organs are destroyed and the host dies. In humans, the process from infection to death only lasts about 7 to 12 days. Tularemia can be treated and cured with antibiotics. However, the complex, evasive nature of this bacterium often prevents timely diagnosis. Scientists continue to learn about Francisella and are exploring new ways to protect people from infection and disease. For example, NIAID researchers are studying an experimental treatment that stimulates the immune system to destroy invading Francisella microbes. Researchers have successfully tested this therapy in the laboratory and in mice, but much more study is needed before it can be tested and effectively used in humans.
Something to tell you. Stop playing there. Carefully listen to me, okay? Because this story is very significant when I was a kid. Are you ready?
Yes, we are.
I remember back in the days, I was so scared and frightened. I thought that it would be my last breath.
Tularemia was discovered by Dr. G.W. McCoy in Tulare County, California, as the cause of a plague-like illness in local ground squirrels, but the term tularemia was first described in 1920 by Dr. Edward Francis.
Where's her daughter?
What happened? Where's our daughter?
Where's her daughter?
Where's she? Oh my gosh, what just happened?
It's feeling hot.
She's what?
Let's go for
Oh my
help.
gosh!
Let's go for help.
She's shivering. She's not breathing. Is she breathing? Oh my gosh! Help! Let's take her to the hospital. Let's take her to the hospital. Let's take her to the hospital. Help! Help! Nurse! Doc! Help!
Hinayaan niyo talaga yung patient din.
Ma'am, sir, I need to interview you about the patient. Can you please sit down here? Okay, ma'am, sir, what happened to the patient?
Doc, a while ago my daughter was playing very well in the backyard, and then all of a sudden I had a blast, and I had a blast, and then we decided to run. And see, and behold, we found our daughter lying down. She was lying down, and she was having, she was so hot to touch, and she was having headache. She's complaining of severe headache. Yeah, that's what she said. It's so painful.
What else, ma'am? What, sir? She's feeling weak and she has dry cough. Thank you, sir.
Mom, how are you feeling now?
I feel better now.
Okay, I'll just call the doctor.
Okay.
Doc, we have a patient in ER, 15-year-old female, with presenting symptoms of chills, sudden headache, weakness, and difficulty of breathing. Also, joint and muscle pains, but the patient is currently stable now.
Alright, okay, let's go check the patient.
Mom, the doctor is here.
Hello, how are you feeling?
I'm good.
Alright, can we just sit you up first? Okay, I'm just gonna check your breathing, alright? Deep breath. I'm just gonna check your nostrils first. Okay. Alright. Nurse, what are her vital signs?
Temp 38.9,
Okay.
BP 130 or over 100, heart rate 130, RR 35.
Okay, nurse, can you please call the examiner? Thank you. Hello, ma'am. Hello, sir. My name is Dr. Balingit. We're suspecting that your daughter has tularemia because she's manifesting flu-like symptoms.
What is that?
Yeah. And so what we're going to do is we're just going to take a diagnostic test first. Just wanted to inform you. It's going to be a sputum culture, and so we're going to do that first. Okay? Thank you. This is for patient 321. Okay, I need you to take these 3 diagnostic tests. Okay?
Sputum, serology, and ELISA test.
Okay, thank you very much.
Okay. Doc, excuse me, here's the latest result of the patient.
Okay. Thank you. Hello, ma'am. Hello, sir. My name is Dr. Balingit. Your child is manifesting actually flu-like symptoms. And so, since we're in a war right now, there's a fever that's going on. I don't know if you've heard about it, but it's called rabbit fever, also known as tularemia. And so what we're going to do is we're just going to take some diagnostic tests just to confirm if it really is tularemia. So we're going to take a culture test, a culture stain, which is we're going to take her sputum, as well as serology and an ELISA test. Yes. Okay. Good afternoon. Hi, I just wanted to let you know that for the lab results that we did on your daughter, it actually confirms that she has positive tularemia.
What is that?
Well, actually, tularemia, I don't know if you know, but I explained it a little bit earlier. You know the common fever that's going around? It's called rabbit fever.
Yes.
It's actually caused, that's another name for tularemia. It's actually caused by an infectious bacteria, and it's an infectious disease as well. Mainly found in animals, usually rodents like rabbits. They are mostly found in them. And so you get this kind of by an example. For example, it could be through an insect bite that was infectious, or handling animal feces, as well as eating contaminated food or drinking contaminated water. So, and of course, breathing in the bacteria.
So how are we going to, is it manageable? Is it are you going to be able to treat it?
Yes, yes. So I'm gonna be prescribing you some medications for her, and this is to help her recover. These are mostly antibiotics, okay? So the antibiotic medications that I'm gonna give you are doxycycline and ciprofloxacin.
Okay, Mom.
Okay, and then you're gonna take this. You're gonna have her take this for 10 to 14 days.
That's very long.
Yes, but if you can't find these medications, you also have alternative medications, which are streptomycin and gentamicin. And these you are to give through injection through the vein or through the muscle. But the other two that I mentioned to you, they're given orally, so you take them by mouth. Okay? Is everything clear?
Yes, Mom.
Okay, here you go.
Thank you so much.
Do you have any more concerns?
Not really.
Alright,
We're just looking forward to our daughter getting well.
yes.
Yes.
Alright, if you need anything, just please let me know. Thank you.
Thank you. Thank you.
Good evening, ma'am, sir.
Good evening.
So these are all the medications that the doctor prescribed to fight the bacteria Fradejas tularensis. These are all antibiotics. First, the streptomycin. You have to take this continuously for 14 days to eradicate all the bacteria that infected your daughter. And also, ciprofloxacin. Please keep your daughter well hydrated before giving this to prevent renal and hepatic toxicity. So this is the streptomycin and this is gentamicin.
So, ma'am, sir, this is the gentamicin. That we've said before, it's an antibiotic, and it's given, we will give it through IV because that's the best route for that. And then for the patient, ma'am, please report if ever you experience any dizziness or ringing in the ears, please report it to us. Okay. We'll prepare it later, we'll just leave it here. Thank you.
Thank you.
Thank you.
Let's go and see her.
Oh dear.
Okay.
How do you feel now?
I feel better.
Do you still feel hot?
Kinda.
Kinda. Okay. The doctors are going to give you some medication, okay?
Okay.
And they're going to take care of you also.
Okay.
They will treat you.
They'll treat you. And you'll be fine. Okay. You want to sleep?
Yeah.
Okay. Sleep, 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 sleep.
Kids, do you know who that was?
It was you, Granny!
So, girls, always be careful because there was an incident in Colorado lately. So you guys go to sleep now